As we explore the world of food, it's easy to assume that simply eating healthy or going vegan will magically solve the problem of global malnutrition. But the reality is far more complex. Malnutrition is a silent killer affecting millions of people around the world. According to the United Nations Food and Agriculture Organization, nearly 820 million people suffer from severe hunger worldwide, while another 2 billion are affected by micronutrient deficiencies. That's 1 in 9 people on our planet struggling to get enough nutrients to survive. Now, you might be thinking that a low-cost plant-based diet would be the answer to this problem. And it is, but only if done correctly. The key is not just about replacing meat with tofu or pasta with quinoa, but about creating an entire food system that prioritizes nutrition and affordability for the most vulnerable populations. Step 1. Identify the nutritional needs of your community. In many parts of the world, traditional diets are rich in nutrient-dense foods like fruits, vegetables, whole grains, and legumes. But these foods often fall out of favor as income levels rise and more expensive, meat-based options become accessible. So it's essential to understand what nutrients are lacking in your local diet and create targeted interventions. For example, a study published in the Journal of Nutrition found that in rural India, where malnutrition is rampant, replacing high-calorie snacks with nutrient-rich fruits and vegetables resulted in significant improvements in nutritional outcomes. In just 12 months, children's anemia rates dropped by 37%, while their energy levels improved dramatically. Step 2. Develop locally sourced, affordable plant-based recipes that can be replicated on a large scale. This means understanding the unique ingredients, spices, and cooking techniques of each region, and creating dishes that are both delicious and nutritious. One organization has made remarkable progress in this area by creating low-cost, high-impact meals using locally sourced ingredients. For example, their sprouted lentil soup recipe uses just a few simple ingredients to create a nutrient-rich meal that costs less than $0.25 per serving. In Rwanda, where they've been implemented, these soups have resulted in a 23% reduction in stunting rates among children under the age of 5. Step 3. Build local food systems that prioritize nutrition and affordability. This means working with small-scale farmers to increase production of nutrient-dense crops, supporting women-led cooperatives to create income-generating opportunities, and advocating for policy changes that prioritize affordable, healthy foods. Countries like Rwanda and Uganda have made significant progress in this area by implementing policies aimed at reducing food prices and increasing access to nutritious food. For example, Rwanda has implemented a food voucher program that allows low-income households to purchase high-calorie foods like sunflower oil and peanuts, resulting in a 17% reduction in child underweight rates. Step 4. Monitor progress and adapt your approach as needed. This means regularly assessing the nutritional impact of your interventions, tracking changes in food prices and availability, and making adjustments based on community feedback and data-driven insights. One example of this is a program implemented in Kenya, where nutritionists worked with local farmers to develop a new crop of nutrient-dense potatoes that could be grown using low-cost irrigation systems. The result? A 35% increase in potato production and a corresponding reduction in malnutrition rates among school-aged children. Step 5. Scale your efforts globally and work towards creating a food system that is truly equitable and just for all. This means partnering with local governments, NGOs, and private sector organizations to create large-scale, sustainable solutions that address the root causes of malnutrition. Statistics show us that when we get this right, the impact can be enormous. For example, a study published in the Journal of Nutrition found that countries that adopted a plant-based diet saw a 40% reduction in greenhouse gas emissions and a corresponding decrease in air pollution-related deaths. And it's not just about numbers. The social and economic benefits are profound. By prioritizing nutrition and affordability, we can empower vulnerable populations to take control of their health, break cycles of poverty, and build more equitable food systems that nourish both people and planet. As we've journeyed through the complex web of global nutrition, it's clear that the trend towards low-cost, plant-based eating has had an unintended consequence, exacerbating malnutrition among the most vulnerable populations. The irony lies in a diet meant to promote health and well-being, instead perpetuating it. We've seen firsthand how industrial-scale agriculture and supply chains are compromising access to nutrient-rich foods, particularly for those who need them most. So what's at stake? The future of global health. As we move forward, we must acknowledge the unbalanced role low-cost, plant-based eating is playing in shaping our world's nutritional landscape. I urge you now to consider your choices, not just as a consumer, but as a global citizen. Join the conversation, support fair trade initiatives, and demand policies that prioritize nutrition over profit. For a healthier, more equitable world, let us choose wisely today.